In today's health headlines, sloth fever has been reported in New York, an update on the West Nile and EEE viruses in the Northeast, and what to know about the updated COVID vaccines. Joining us now is Yale Medicine infectious diseases specialist and professor of medicine at Yale School of Medicine, Dr. Albert Shaw. Thank you for being here, doctor.
Yeah, thanks for having me.
All right, let's talk about sloth fever. This is transmitted by small biting flies and mosquitoes cropping up in New York as people come back apparently from summer travel. What should we know about this?
Yeah, so the name comes from the fact that sloths can be infected with this virus. It's called the Oropouche virus. It's named for a location in Trinidad and Tobago where the virus was first discovered. What prompted the CDC advisory was a report of about 8,000 or over 8,000 cases in countries in South America. This would be Brazil, Bolivia, Colombia, and Peru, as well as Cuba. It's all of the cases that are reported in the U.S. have been associated with travel to those countries. So, for example, there have been about 20 cases or so in Florida and one, as you just mentioned, in New York State. There's no evidence that there's any transmission in those insects in the U.S., but this is a potentially serious virus. There have been 2 deaths reported in women that were otherwise young and healthy in Brazil, and there's concern that infection in pregnant women can have potentially serious or life-threatening consequences for the fetus. So it's something to be definitely aware of if you are planning travel to those particular locations.
You know, it's tough to avoid mosquito bites this time of year, but with the risks of West Nile and EEE viruses out there right now, what's the best advice to stay safe till we get to the fall?
Yeah, I think we have to be aware that mosquitoes like to be active or biting between dusk and dawn, particularly dusk and a few hours afterwards. So definitely, if you're out during those times, wear a repellent that has been shown to be effective. Repellents, for example, containing DEET or picaridin on exposed skin. If you have standing water near your property, that's where mosquitoes like to breed, so try to eliminate that. Deal with any holes in window screens that can emit mosquitoes. We've had mosquitoes carrying the EEE virus reported in Windham and London County so far. Mosquitoes with the West Nile virus pretty much been detected across the state. We heard this week, for example, Dr. Anthony Fauci was hospitalized in Maryland for the West Nile fever. So something to be definitely aware of, try to minimize mosquito bites as much as we can.
Okay, newly updated COVID vaccines are being rolled out now for the fall and winter. What can you tell us about those? When can we get them? Where can we get them?
Yeah, these are the mRNA vaccines targeting the KP2 variant of the COVID virus. They should be widely available around the state. You can check with your healthcare provider, or they are already widely available at pharmacies around the state. You can find one near you at the vaccines.gov website by entering your zip code. We think that this updated booster should provide good protection against the variants that are currently circulating. It's recommended everyone 6 months of age get the vaccine. I would say particularly those at high risk for serious outcomes from COVID, those that are, all of us that are older, have pre-existing medical conditions, weakened immune systems. But I think there's an unknown risk for long COVID. It's unpredictable, can be very debilitating. And we also try to protect those in our families that are at highest risk by getting the vaccine as well. So definitely something I think to put on your to-do list for the fall.
All right, Dr. Albert Shaw, appreciate your time. Have a great holiday weekend.
Thanks, you too. Thanks again for having me.